Good afternoon, everybody. How are you today? I hope you are still safe. Stay safe and stay at home. Today we have another lectures on community public health, which is the end of the lectures, which is what you call dental public health issues and challenges. Okay. Okay. The outline, learning outlines, the learning outcomes that you can get from these lectures. We have to outline the issues and challenges in the Malaysian healthcare system and to outline the key oral health goal for the year 2020. Okay. These are some of the issues and challenges that we are facing right now. Some are already improved, maybe, but some are still not improved. Okay. First thing is one is policies of other ministries not in line with MOH. Second issue is a lack of public awareness. Third issue is weakness of program implementation. Fourth issues may be the constraint in empowering women and specific risk groups. Third is constraint in creating supportive environment. The sixth one is lack of resources. 7, organizational issues. And the 8 is weakness of legislation and enforcement. And we will try to see one by one exactly what are the changes or what improvements have been made, especially by the government. Okay. Issues and challenges encountered in health promotions. Okay. One is the lack of public awareness. Okay, maybe lack of community participations, individual behavior, following improper and non-balanced diet, more preferences given to fast food and instant food, lack of physical activity, alcohol, cigarette, and other drug use, following improper hand washing technique and not knowing is important, and reckless behavior. Alright, first thing, lack of community participations. Actually, we have a lot of community participations in the oral health promotions in the community, especially nowadays that you have the COVID-19 outbreak, which is the government is responsible to break the chain of the disease, the spread of the disease. So actually, considering lack of community participation, much of this has already been improved. Okay. Individual behavior, laziness, and irresponsible behavior. This may lead to more to together with non-balanced diet and preferences given to fast food and instant food, lack of physical activity. These all lead to what you call lazy what you call diabetics problems in the community, and also oversize or overweight of the populations. Not only overweight, now we have overweight problem have been big issues in the community. Not only the elders, but also with the young people or the younger generations or teenagers. All right, this is more to them given fast food and instant food, which contain a lot of cholesterol instead of a lot of protein. And lack of physical activities actually may be due to playing games on the internet, on laptop, on handphones, which is easily available these days. Okay. Alcohol, cigarette, and other drug use have been a major problem these days. Got a lot of not only elder people but young people. They use all kind of alcohol and all type of cigarettes, legal or non legal cigarettes, and other drug use that kill a lot of younger generations. Okay, following proper hand washing technique. Actually, with a lot of advertisement in the medias, big billboard, there's a proper hand washing, especially now that there is spread of COVID-19. By now, people know the importance of washing hands as regular as possible, even inside your own house. Okay, and reckless behavior, those who what do you call racing, motorbike race, which they do the racing without thinking of other road users. Weakness of program implementations. Many staff lack of skills and confidence to implement programs. Okay, problems pertaining to implementation of health promotions and lack of availability of products or materials that you need for health promotions. High cost in conducting the program and giving appropriate treatment, lack of insurance coverage for the community, limited language access. Actually, these few things that have all been overcome by the government in the sense that they are continuously giving training to those who need to give the services, the particular services to the community. Okay. Example, they have this example, they have this program that involve the community in fighting the dengue by having peoples in the community participating in the to make sure that their places, their areas, or their housing areas are clean, and so that it is lack of things or places or no that could have the mosquitoes, the dengue mosquitoes spreading. So it has been done due to the increase in dengue in the last few years. Okay. High cost in conducting the program and giving appropriate treatment. Certain things, if you are to launch the program in a bigger scale, that may be add to the cost. But otherwise, every programs, it is the cost can be backed by the government itself. Right? Lack of insurance coverage by the of the people, limited language access. Usually, community, most of the communities in the Malaysia, they are provisioned in Bahasa Malaysia as the official language of Malaysia. So if we conduct a promotion, if conduct any program in Bahasa Malaysia, most of the people, most of the community will understand it and can get the benefit of the program. Okay, unmet health needs. Of course, with a lot of people these days, health needs is increasing. Government health clinics are strong by people, especially those what you call a B40 communities. But otherwise, we have the private sectors to help meet the health needs of the people. Okay. Delays in receiving appropriate care. When there are so many people, the facilities is strong by people. We feel that we are delays in receiving appropriate care. Inability to get preventive services. That's also sometimes it is true and sometimes it's not true in our communities. Hospitalization could have been prevented. Okay. Focus is more on individual and his or her health behavior instead of a community. Now everybody goes for community. Let it be the old age or Wagamas. Let it be the diabetic group. Let it be the what do you call uh, the high blood pressure group, or the have all these different group. They have a program in the KK where they come maybe once a week or what, so that they can have a good exercise, and before the problem is checked by the appropriate health workers. Okay. Does not address the total person or his or her health needs in a holistic manner. That could be true also. Difficulty in evaluating behavior change in an objective manner. As we know, in Malaysia, cases of NCD is increasing. So it is also behavior of the people that cause the increase in the NCD cases. Okay. Lack of resources. The third one is lack of resources. Information and communication technology involvement is poor. Before, we don't have much ICT in the health program. Even if we have, a lot of people have no access to it. But nowadays, with the easy use of easy attaining of high-end handphone, computers. There's more what you call messages, and researchers are easily available at the tip of your fingers. And with most places have this wide range of what you call high up unified or whatever it is. It is much easier for people to get information from the technology, ICT. Research and evaluation poor. Lack of resources and facilities for personal skill development. Nowadays, more uh, more clinics or more schools for developing personal skill development in the health facilities have been developed. In fact, for private hospitals, they are they are training their own personnel, like the nurses, medical nurses, medical house assistants, they're training themselves for their use in their private hospitals. Even government also have been increasing the number of personnel that was to be needed in the in the services of the uh, hospitals and the clinics kesihatan. Natural environments such as plants, weather, and climate change. The campaign for planting of plants have been going on for some times, for a few years, where each house will plant one tree. Whether it's possible or not possible, the campaign has been done. And those who have areas in their house where they can plant like their own vegetables, they are encouraged to plant their own what you call flowers or green plants or even vegetables within their compound. Okay, the weather and the climate change. Okay, you can see now with the outbreak of COVID-19 for the whole of the world, the weather of the world is much better. You know why? Because there is no more carbon monoxide that was released into the air, because everybody is staying home, and very much less of the people moving in using a car or most of the places we don't have any traffic on the busy road. So that, in a way, have improved the weather and the climate change of the world. So be thankful to that COVID-19. Okay. World environments such as building or transportations. Yes, that may cause a problem. Buildings and transportations like MRT, LRT, all that in a way have increased in numbers, and that they are causing uh, environment changes in a way one way or two. And for buildings, there are a lot more buildings, high, tall, rise buildings being built near to each other. So that is not very healthy actually. Okay. Roadside, school, and recreational settings. We have improved on the roadside. The schools, now the schools have their own area for students to sit and be friendly with the environment, and recreational settings. Of course, now every housing area, they are supposed to have their own recreational settings, which in most places in the big town they have, big or small, but they have. And it's up to the community in that area to uh, to 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 and it's up to the community in that area to use their recreational settings. Housing, homes, and neighborhoods. Okay, with nowadays Malaysia have more housing, more homes, and neighborhoods. I think we help each others or help our neighbors to look into the cleanliness of their housing areas. Okay. Exposure to toxic substances and other physical hazards. This one we can consider toxic substances such as maybe our our waste, wet or dry waste, which is nowadays they did not collect our waste every day as they used to last time. Nowadays they collect it maybe twice a week, and between collection the waste have been toxic one way or another. As physical barriers, especially for people with disabilities. These have people with disabilities, all right, those who are on wheelchairs. We find that most of them cannot move to or cannot go to uh, other housing areas or shopping complex to do their shoppings or for their basic necessities. But nowadays we find that even the buses also have facilities to carry people on wheelchairs. Even in entrance to the supermarket, they have this ramp where the people with people on wheelchair can enter the supermarkets. Okay, but of course there are a lot more places and facilities, public transport that need to have facilities for people with disabilities. Right? Aesthetic elements such as good lighting, trees, or benches. Alright, in kampung-kampung or in places far away from town, of course you may not have good lighting or trees or benches. It's quite dark at night. Okay, but now things has improved. Okay, but it may not be improved as much as we like, but it has improved. Okay. Organizational issues. Health promotion still a new paradigm in public health worldwide? Actually, we have done a lot of health promotions. Example, lack of cigarettes or tak nak the cigarettes advertisement. Okay, it has been done all over the countries in many ways. But I feel it is also true in other aspects lah. Okay, but as I said again, with the COVID-19 happening in our country, this health promotion have gone. At least they have encouraging people to wash their hands, to protect themselves by using masks, or to not just to simply go to public places where there is not of necessity to them. And even now, if you need to go to public facilities or supermarket or market, wet market, you have to be distant from each other, at least 1 meter. That's why they have to queue up to enter the public places. Treatment mindset approach. Of course, most people will only search the clinics when they need, and of course when they go there they want treatment. They do not need to have other things, they want treatment. So to them, the clinic facilities is for them to get treatment when they need to. Right? It is still happening, but as I said before, the clinic also organize program for the diabetes, program for the elderly, program for the disabled people, so that in a way they have changed their mindset approach to the clinics. Okay, This difficulty in sustainability, lack of dedicated and specific staff at district level, hopefully this have improved. Whether a lot or small, it has improved. Poor coordination at different levels. Okay, usually the new circulars will come for the top management, and it takes some time to be implemented by the ground level. Okay. Constraint in creating supportive environment. Too many launching celebrations of health events or days. Certain activities do not benefit some target groups. Lack of health promotion projects carried out at community level. With economic constraint of the country, everything also is less than usual or less than before. But as much as possible, the health workers will continue the program that they already started until there are lack of revenue to do it. Weakness of legislation and enforcement. Policies at the local, state, and federal level affect individual and population health. Increasing taxes on tobacco reduces the number of people using tobacco products, can improve population health. That is very true. But then, by increasing the price of tobacco, will reduce the number of people using tobacco products. This thing have to be proved to be true. Then only we can say that we can improve the population health. Removing the subsidy for sugar will lead to lesser consumption of sugar and reduce risk to diabetes, dental caries, atherosclerosis, cardiovascular disease, and obesity. This again, by removing the subsidy, the cost of sugar will increase. But how much does this affect the consumption of sugar by the high-risk people? Okay. Some policies affect entire population over extended periods of time while simultaneously helping to change individual behavior. We can see that in this outbreak of COVID-19. I think most people have changed their behavior one way or another towards a healthy or more safe and healthy way of living. For example, in 1966 Highway Safety Act and the National Traffic and Motor Vehicle Safety Act authorized the federal government to set and regulate standards for motor vehicles and highways. This led to an increase in safety standards for cars, including seat belts, which in turn reduced rates of injuries and deaths from motor vehicle accidents. Okay, I don't want to comment on this. Policies of other ministries not in line with ministries of health. Okay, poor multi-sectoral involvement like education, agriculture, transport, economy, finance, housing, and no private sector involvements. Some teams are under the purview of other agencies. Okay, actually, this is not very true all the time, but it is happening. It is happening, but it's not all the time. Sometimes the private agencies also help in financing the government in promoting certain health promotions. Okay, this is the key oral health goal for year 2020, which is how we can see government trying very hard to match the key goals or to achieve the key goals by year 2020. So government take it is as their responsibility to achieve the key goals. All right. And the dental caries, 50% of 6-year-old are caries free, 70% of 12-year-olds are caries free, and 15% of 16-year-old are caries free. So after this, we will see the results, whether we achieve the goal or not. Periodontal conditions, 50% of 16-year-olds have healthy periodontiums. Dentition status, percentage of adults in 35 to 44 age group are edentulous. 0% of adults in the 35 to 44 age group are edentulous. 60% of 60-year-old have at least 20 teeth. And with oral cancer, 30% of oral cancer are detected at stage 1. That's why we need to promote all this to the children and to adults about our health goals so that they will do the necessary actions. Okay, this is talking about obesity, and with children have become obese. We have this school canteen program or school canteen menu where we allow certain food to be served in the canteen. Okay. And this is a few Malaysian food pyramids. Okay, food laboratories under Ministry of Health. We have almost every state have one food laboratories where they check the quality of food or that is served to the house, to the government, to the hospitals. Okay, this is campaign that we have to reduce the use of sugar. Satu sudu dah cukup. Okay, obesity and NCD in Malaysia. Actually, Malaysia have cases of overweight and obesity which is double over the past decade among the adults, from 21% in 1996 to 43% in 2006. Okay, and recently it was reported that 44.5% high among adolescents and 19% and children from 20.7% in 2002 to 26.1% in 2008. All right. Among the available tools to prevent and deal with the development of obesity are nutrition and food educations, and they should play a leading role. Okay, obesity has been our main problem with the young as well as with the adults, with the adolescents. Okay, so this is some of the preventive measures that we do so that we can prevent further development of caries. Okay, the first thing is the putting fluoride in the community water supply. The second one is the putting fissure sealant in children who have only erupted sixes, who have newly erupted sixes. That is about 5 or 6 years old or 7 years old when they start schooling. And the other program is we use a oral health program in school, which is very active these days. where we do the toothbrushing, and we also do the fluoride mouthwash, given a fluoride mouthwash to children. And this other thing, the preventive measures, if when we apply fluoride varnish to the teeth suspected to the teeth of children, yeah. Actually, fluoride varnish we usually do in a 2-year-old children for 5 consecutive applications. Okay, the key goals. How are we going to go about in making sure that we have we will achieve the key goals that we have talked about recently. Okay, periodontal conditions. The key goals: 50% of 16-year-olds with healthy periodontium. Promote personal care. Toothbrushing with fluoridated toothpaste towards daily use of dental floss. And activity or action plan, we have TBD, toothbrush daily as a daily SOP activity for all nurseries and preschools. We encourage, other than primary school and secondary school, we are also now going into the nurseries and the preschools available in the community. Oral health literacy for parents, carers of toddlers, antenatal mothers, and frontline health professionals. We have this program where we give talks. The health personnel will give talk to the parents or parents to be, or those attended the antenatal clinics, okay, antenatal mothers, on all aspects of caring for their children. Okay, the dental also involved in this, where we give talk to the antenatal mothers in the antenatal clinic itself. Okay, so they become the frontline health personnel. We also give health talk to the carers of toddlers and the parents when they are present, sometimes for for get to know, or for the canteen days in the tadikas and in the nurseries. Okay. To promote flossing behavior among teenagers. Teenagers by the age of above 12, they should be able to take care of their teeth or their oral health, so that their smile will look stunning. Okay. Agencies that involved will be the MOH, or also the multi-sectoral involvements. Usually, the medical will work together with the dental. Okay, and we have a good rapport with the preschool and the nursery associations of association in Malaysia itself. And the flossing product manufacturer, this have to talk to the flossing products to the manufacturer. First, dental act, private sectors dental act. Okay, the second key goals that we are going through ialah dental caries and periodontal disease in adults. Okay, as we said before, 0% of 30. We do not want any adults within the age 35 to 44 are edentulous. Okay, and we hopefully those who are wargamas or 60 plus, they have at least 20 teeth, right? So that they are able to function. Okay, increase preventive behavior in adults. Adults will come to the clinics on their own, meaning to say when they need, they will come to the clinics. And these are the people that we go to, that we encourage them. Well, we give half out to them. We show them how to floss, and it's still up to them to do whatever is necessary for themselves. Okay. Action plan to be developed with multi-sectoral involvement, including proposal for public and private sectors and dental industry on following themes. Promote preventive visits among adults as a way of life. Promote flossing behavior and improve toothbrushing effectiveness among adults. CPD in preventive dentistry for oral health personnel, private sector dentists, and their staff, marketing of preventive services. To consider establishment of a scheme for dental hygienists. Okay. Promote public demand for preventive dental services. This dental hygienist we are talking about is not the present dental nurses. This dental hygienist is a different entity totally. But now we know that formerly we call them dental nurses, but now we call them dental hygienists. Okay? These dental nurses or dental hygienists, they actually do treatment on the patients below the age of 17. So they do what the dental officer can do, but there is a limitation to it, and they work under supervision, direct or indirect supervisions. Okay. Promote public demand for preventive dental services. Propose fiscal policies for government. Okay, financing for adults of oral health care to include free checkup. Tax incentive for annual dental checkup, preventive. Okay, we have involved all the private sector, the general dental practitioners, the MDA, the MOH as a whole. That can be done actually. Okay, this is some of the activities shown that is done by the private sectors. Okay, it is for the ministry, but it's done by the private sector. Oral cancer. Adults, we want to screen adults 20 years and above, so that anything we can actually capture the stage 1 cancer, stage 1 oral cancer. So the key cause is 30% of oral carcinoma cases detected at stage 1. Okay, there is the strategies by strengthening primary prevention and promote early detection of oral lesions. Activities, we have to strengthen screening program. Whenever the health workers will have to meet the public, they will do the screening, the oral cancer screening at the same time. Okay. Okay, these agencies involve maybe the MOH, multi-sectoral involvements by other agencies, or Oral Cancer Research and Coordinating Center, OCRC. Okay, aging population. We must not at this point of time forget the aging population. What do you mean by aging population? By 2035, more than 10% of Malaysian population will be 60 years and above. Healthcare must recognize this fact and take steps to prepare for it. The future healthcare system must cater for this group of people. Okay. Another key goals that we are talking about is the dental and maxillofacial injuries. People less than 20 years old they have domestic have injuries, maxillofacial injuries, whether domestic, playground, school, MVA if they are more than 20 years, or even they are less than 20 years. They already have a motorcycle license, and I'm sure when you are new and not used to it, you may tend to forget how to handle the motorcycles, which a lot of cases we hear that MVA which causes bone fracture or facial fractures for that matter. Okay, strategies: reduce preventable domestic and sports injuries, reduce prevalence and severity of facial bone injuries due to MVA, support all initiatives to promote use of safe public transport. Activities that can be done: advocate mouthguard for contact sports with MOE, Ministry of Education, Ministry of Youth and Sports. Advocate for full use of full face helmets for motorcyclists and fast sports. Okay. Support rear seat belt use and place mechanism for data collections. Agencies involved: MOH, MOE, Ministry of Youth and Sport, Ministry of Transport, Road Transport Department. Okay, these are few things that that we can use to protect ourselves from injuries. Okay, other these days, I'm not sure which year, government already implement the use of vehicle seat belt for the passengers, back passengers. Right? Enhance oral health uh, enhance oral health related quality of life and reduce pain and discomfort. Cleft lip, cleft palates, special needs groups, the elderly, the disadvantaged, the marginalized, the handicapped, pain and discomfort, oral health related quality of life, potentially malignant lesions. Okay, strategies. We have to strengthen monitoring database on conditions cleft lip and cleft palate. Okay, oral health status of special needs children, special needs group, oral health pain and discomfort, and oral health related quality of life, potentially malignant lesions and high risk habits to oral malignancies. Okay. Agencies involved, maybe the universities, the MOH, MDA, GDPs. Okay. Primary healthcare reference, hospital centers of excellence, and then local or public training institutes. All this, I think you can read, is quite clearly mentioned, and you can read and understand this. Okay. Health promotion campaigns. As you know, we always have health promotion campaigns, including the PIDC students doing health promotion campaign or health project to the usually mainly to the preschool children. Health people to 2020 summary of objective or oral health. Okay, I think these all on your own. I don't need this. Okay, this is the existing facilities that we have in the government. At this point of time, certain hospitals are quite crowded depending on the locality of the hospitals. Okay, but most government hospital by nowadays is quite crowded in the sense that space between beds in the hospital is only about what you call, you can only put a chair there, one chair for visitors. Okay, accessibility to healthcare. Malaysia currently has a dichotomous public-private system of healthcare for services. Of course, we have mainly government hospital, government clinics, but also a lot of private clinics and private hospital already not available in Malaysia. Even though we are saying that government is responsible for providing adequate healthcare and education as both basic fundamental rights necessary for creating an advanced society, but we also know that those who have money, those who have insurance, medical insurance, they can go to get uh, their health checkup or to get their treatment in the private hospitals. Nowadays, private hospital, they have a more advanced technology to cope with the uh, recent diseases that is upcoming, that is newly in the world. Okay. Aging population and measuring healthcare performance. In the year 2030, Malaysia population will be as old as aging Japan. Okay. In Japan, comparatively, they spend 8% of their GDP with 80% funding by governments. Okay. But in Malaysia, if you are a government servant before, your healthcare will be taken care of by the Malaysian hospitals. But if you have your insurance, medical insurance, you can also opt to go for private sectors. Okay. Life expectancy in 1957 to 2008. Male have less life expectancy, about 71% in 2003, and female have a higher life expectancy of about 76 years of age. Right? Healthcare utilization, world ranking over GDP percent is about 156 in the world. Public healthcare facility utilization, inpatient treatment is about 75%. Outpatient treatment is 90%. Okay. Proportion of government spending, 52% of total healthcare expenses. Far higher cost of private but far higher cost in the private facilities. Lack of affordability for the majority to use private healthcare. As I said before, those who have money, they can opt to go for private facilities, which is much better. In many aspects, they are much better and they can get the treatment much faster than the government. Summary healthcare. Many indicators with different expectations. Patients, the doctors, the healthcare providers, the supply chain, the agencies that regulate healthcare activities, and the government. Okay, so if you see this, you can make out what it is about. Other than government facilities, we have the Ministry of Health, we have the Armed Forces, we have the Department of Aborigines now already put under Ministry of Health. We have the Ministry of Home Affairs. Ministry of Home Affairs, we have the what you call military hospitals. All right, we have a few militaries also. They, as far as possible, they treat their own people when they are still in service, so that they do not load the government hospitals. They have their own facilities, they have their own specialists, they have their own what you call hospitals. which is also with a good facilities, updated facilities. Okay? Measuring healthcare of a nation. A monitoring plan that can ensure continuous improvement in quality, effectiveness, accountability, and most importantly, affordability. Holistic aspects of healthcare: patient satisfaction, healthcare professional efficiency, utilizations of the facilities, clinical quality, equipment, technology, and financial performance. Okay, and healthcare indicators. All these indicators we have what you call in our data. We are taking all these indicators every day of the working day. So Malaysia is good. It's not bad among the countries like Singapore, Thailand, Japan, UK, US, and Zimbabwe. Okay. Privatization of healthcare and profiteering, private hospitals and CLGS. Okay, a few services in the government facilities have been privatized. Okay. Okay. Role of government in healthcare. The government is wearing three hats: as a public healthcare provider, as a regulator, as an investor in profiteering from healthcare. Example, large health conglomerates, government-linked companies like Samdabi, Pantai, Khazanah, KPJ, and others account for more than 40% of private hospital beds. This comes with clear conflict of interest. Okay, state versus private healthcare sectors. For the state or government, mostly located in the rural areas, the user fees are low or free, mostly used by the lower socioeconomic group, the B40s. The number of health sector is reducing. Overcrowded with long visiting lists due to lower user fees, lower salaries to doctors, hence lack of manpower as many doctors choose to work with private hospitals. But the private hospital located in the urban areas, the user fees are higher, mostly by the higher income groups. The number of health sector is growing. Faster provision of services due to fewer patients and more doctors. Higher salaries to doctors. Thus, many doctors join these sectors, giving it a lot of men. Okay. Insurance, supply, over demand, and third-party administrators' expenses. Estimated cost for hospitalization, 30 billion per year. Sharp spike in the cost of healthcare services due to over-investigations. Okay, usually at the private hospitals, over-treatment, increasing cost of litigations, increasing cost of litigation, managed care organization, and increased specialist fees. Okay, this practice has resulted in an offset. Okay, Malaysian Healthcare Human Resources 2017. Ratios to population: doctors 1 to 632, dentists 1 to 4,406. The nurses, you have about 2,845. Then the technologists, we have about 1,855. Dental surgery assistant, 4,177. Private dental clinic, we have about 1,992. Government dental clinic, 729. School dental clinic 925, mobile dental clinic 35, and dental mobile teams we have about 586. Okay, with 2,789 portable. Malaysian healthcare facilities 2017. 144 public hospital with 41,995 beds. 187 private hospital with 13,957 beds. Okay, there are now only 44 training hospitals. Existing doctors who are stressed thin with the heavy workload will also not be able to provide the best of training for housemen. Some 300 doctors and 50 specialists leave the private sector. Okay. Affordable Care Act and non-profit hospitals. We do have in South Korea, focus on prevention approach, annual medical screening. In Indonesia, they have this Muhammadiyah, which has more than 5,000 schools, and now has free hospitals and clinics. And they have this Karnataka Yashasvini scheme. Okay, and this is my references for my lecture today. And actually, for the Ministry of Health, I can only get the data for 2017. There is no data for 2018, 2019, and 2020. I suppose it will come later. I will update my notes when I have the 2020 data. Thank you very much, everybody. And again, stay safe, stay at home, and always be on the alert for the lectures and for some discussions later. Alright, I will inform you if I will have a discussion on this topic during the lecture time. Alright, thank you very much, everybody.